I think for me, one of the things I try to highlight in this work is the diversity within the AANHPI group. In fact, I think the aggregation sometimes masks some issues. So I'll give you an example. We're often held up as the model minority, which was a concept that was divided to create a wedge among people of color. So kind of a myth. And we're held up as that because we have the highest average income. But that's not actually true. If you disaggregate the data and look at income across the 50 plus ethnicities that make up the group, we are among some of the lowest as well. And so I think the important thing when you're looking at the AANHPI group is to dig a little deeper in the data if you can and begin to disaggregate it. I think that's important too when we're looking at health inequities as well.
This is Associations Thrive, the podcast celebrating successful associations and their leaders. I'm your host, Joanna Pineda, CEO and Chief Troublemaker at Matrix Group International. Listen in as top association executives tell all, revealing the creative and innovative ways they're increasing membership, generating revenue, nurturing engagement, and reimagining their organizations. By the way, if you've launched a new initiative, created new member services, or updated your governance structure and are seeing great results, I want to hear your story, and so do my listeners. I'd love to have you as a guest. Go to podcast.matrixgroup.net and apply to be on Associations Thrive. Now let's dive into this week's show. Today, I'm speaking with Wendy-Jo Toyama, CEO of the American Academy of Hospice and Palliative Medicine, a client of the Association Management Center. Wendy, welcome back to Associations Thrive.
It's so much fun to be back. Thank you, Joanna. I'm looking forward to our chat today.
Wendy, when we met last year, you talked about the 4 pillars or the 4 focus areas. And I hope I get this right. They were being interdisciplinary, establishing a culture of giving, DE&I, specifically focused on health equity, and data analytics. So what did you focus on in the last year and what kind of progress did you make?
I think as we looked at the future plan, there's a lot more external focus than internal, right? So some of what was on that list was internal, the data analytics. DEI can be both. But we were really looking at what is our position in the field and who are we the home for? So while we remain the physician organization, we have increased voice and vote for our interdisciplinary team members. I mentioned that last time. And I think we realized in this planning session, we have to think more about how are we the home for those interdisciplinary team members? What does that look like? We've also been thinking about that as it relates to our academic researchers. There's been some changes in the external environment, some of our funded programs that really helped young researchers connect with senior researchers are sunsetting. And so, finding a home for those activities has been important. And then also making sure we remain the home for our folks in hospice. Hospice was under attack recently with concerns around quality and fraud. And so, making sure that we are taking on those issues and that our hospice folks feel like we continue to be their home. And frankly, the whole space is going to change as we see more home-based and community-based care. So what does that mean for us, as we look at population health? So I would say the big shift was toward that sort of more external focus.
Wendy, you just shared a whole lot there for me to unpack. But let me just say this. First of all, it's May 2024, and Matrix Group is 25 years old.
Yeah.
So for this interview, I'd like for us to think about the future. I mean, within my company, we're talking about how do we celebrate the past, but how do we think about the future and plan for the future? So it sounds like with the new strategic plan and some of your activities that you're focused on the future. So could you tell us about that planning?
Yeah, I think as we think about the future, and I mean we people, not necessarily just our field, I think there are a lot of assumptions made about Gen Xers. And I think we need to be sure that we back that up with data. I feel like associations at the heart are about creating a sense of belonging. It's really about belonging and connecting people and building communities. And so while we're seeing more and more virtual kinds of access, are creating inclusion, I don't think that role for associations is going to change or go away. And I think what that looks like could change, right? So we're struggling with, we've added a remote aspect to our meeting. So it's omni-channel. Are we going to keep doing that? I think we probably will, right? But that changes the whole business model and budget, but it creates such great accessibility. So I think that's just one snippet of an example of how does creating that sense of belonging community change as we move into the future. In the short term, I think everybody's talking about AI, but I think the important thing to think about here is not what it's going to take away or the risks, which of course we have to think about, but the opportunities that it'll bring for us and how that will transform. I think for small associations, it could augment their workforce and allow higher quality and higher volume work than maybe before. So I think there are a lot of positive opportunities. And I think right now I feel a lot of fear because we don't know as much about it as we want to. So that's kind of more in the short term.
Wendy, is there effort going into thinking about what the profession, hospice and palliative medicine, will look like in 25 years?
I would say as part of strategic planning, we do talk about that. So sure. I think I can tell you a lot of focus right now is on the fact that the current Medicare benefit for hospice is 40 years old and probably no longer fits the disease progression that we now see. So there's some talk about how does that Medicare benefit need to change. We also talk about wanting to see how palliative care could also be included in the benefit, so TBD how that plays out. And we do see a shift toward, and I think the pandemic helped with this, more people wanting to get care at home. So I think we'll be seeing shifts in that regard. So for example, expanding access through telehealth is being looked at. So things like that will change where care happens. I think those are some of the things that we think about.
How does this affect then like the service offerings that the association then provides to the members?
I think that associations still are about providing education, forums for networking and sharing, building that sense of community. I think the way that it changes it is how those things happen potentially. Just a small example. Are we going to still be publishing books? Or are we going to look at creating modular nuggets that can be updated and accessed digitally? So again, I think it's how we do the things we've always done. Not a very sexy answer, but I do think the basics of we're going to help educate our members, we're going to bring them together and create a sense of community. I don't think those things are going to change. What will change is there's going to be a more competitive environment out there for places where people can belong. So I think we have to be more thoughtful about creating a unique value for our members because I think they're going to be able to access education. They're going to be able to build a sense of community with or without the association. So we have to figure out how we become the place where they turn for those things. What makes us unique? What's our unique value proposition?
Wendy, you talked about a little bit of fear with regard to some of the changes and with AI, for example. I know that in the tech space, there's a lot of excitement.
Oh, yeah.
The space where I kind of live, right? I've heard people say, wow, it feels like 1995 all over again, 1999, where there's a lot of excitement. And definitely there are some detractors, but there's a sense of excitement and feeling like everything's wide open. What's the feeling in your space?
Well, I think in the healthcare space, I was with the Council on Medical Specialty Societies this week, this coalition of 53 different medical specialty societies. So 30, 40 of us CEOs were together and had a presentation on AI. And I think some of it is related to bias that gets built into AI, hallucinations that occur in AI. And if those apply to delivery of patient care, there could be very adverse outcomes. So I think some of it is how do we refine the tools to address some of the built-in biases that come or hallucinations that occur so that we don't harm patients. So I think that's one area of fear. I think another area just has to do with, as an association CEO, understanding how to manage the risk. And one thing that I thought was really interesting is, sure, there can be risk to your association because you inadvertently use copyrighted material that was put into a large language model, or, so there's those kinds of risks. But there are also risks occurring out there to organizations that don't use AI.
Right.
When there are models out there. So that's really interesting. That was like a light bulb for me. And I think we're going to see more and more of that, right? As these tools become more effective at helping identify if a particular healthcare center is underdiagnosing a problem, for example. And then, a patient finds out and they want to sue you because you didn't catch it. I think we will get to a point where things like that, well, I guess we're already there.
Right. I mean, in the healthcare space, there's so much promise to look at and analyze large data sets.
Right.
That will help you catch the really rare and obscure conditions. And that's what you're talking about potentially, or a misdiagnosis because you missed something in the data.
Or just centers where they're underdiagnosing something. I used to think about this when we thought about employed dentistry, that the group practices are the ones that can find if they're underdiagnosing gum disease, as an example, because they have a large data set and they can see that, this is about the rate it gets diagnosed, 4%, let's just say 4%, random number. But, in our large employed practice, we're only diagnosing 2%. So we're probably underdiagnosing, right?
Well, Wendy, there's another anniversary that's being celebrated this year, and that's AMC's, because AMC is 50 years this year. So amazing.
Yeah, it's our 50th anniversary.
So tell us about the journey and the decision to join AMC.
Joanna, I'm glad you asked that question, because I think for a lot of association professionals who are trying to make that jump from mid-level to C-suite, they may use an association management company as sort of that entry point, right? So you go into an AMC and there's a lot of support there for you and back-end services. And it's a good way to kind of cut your teeth and work with the board. And then you move out into an independent. My journey was different. When I landed my first CEO position, it was with a small independent association. And I remember talking to a mentor, because I had only been in large organizations to that time, and kind of just getting some thoughts. And he said, well, if you go to a small association and you don't like small, it's 40, 50, 60, 70 hours a week, and you won't like it. He said, however, they're very entrepreneurial. And I'm like, ooh. And so it did turn out that while a different size than I'm used to, I really enjoyed my small association experience. I learned so much because they're resource constrained and you do everything. And then when I wanted to go to a larger association, I actually landed at AMC with the Academy, which is a little bit non-traditional, right? To go from an independent to an AMC.
Right.
But I will tell you, for me, it was a fantastic move for a couple of reasons. One reason is that DEI is very important to me. I led with my values in my search, and AMC has a culture that really aligned with my values. And so I knew I could find a good home there. And additionally, starting in the pandemic meant when the world had to turn to remote, I didn't need to make any decisions on our IT readiness, our policies, and working from home, because we had an HR department and an IT department at AMC that did that. So during the pandemic, I could concentrate on getting the staff and the members through sort of this traumatic time and focus on the board relationships and the programs, because I knew that other aspect was being handled quite well by highly experienced, knowledgeable professionals. Whereas at a small independent, I'd be doing it myself, or it'd be a fractional employee helping me, or, so it's been fantastic. Although, as I said, a little non-traditional.
Wendy, AMCs are pretty common in our space. So how does AMC operate, and what are they doing differently to thrive in this space?
Just to make the distinction for everyone, The Association Management Center has the same initials, AMC.
That's right.
Yeah. So at the Association Management Center, I already mentioned that I was attracted to the DEI efforts that were occurring there. And I'm pleased to share that AMC has won a Diversity in Business Award from the Daily Herald 3 years running, 21, 22, and 23. And some of the things they do on this front, I love. So we have a DEI advisory group, which is great. We'll conduct a pulse survey to get kind of feedback from the employees about what's important to them on this score. But my favorite things is we have a DEI week every year.
Oh,
Yeah, and it's really fun. We have trivia. There are different planned presentations. We've toured the Holocaust Museum in Skokie with a field trip. But I love DEI week. I think that's wonderful. We also have a number of ERGs. And again, I think in this vein, we're a little bit different. So we do have a BIPOC ERG and LGBTQIA+, but we have one for working parents. We have one for caregivers of older adults, which I think is very unique.
so all of these ERGs are employer resource groups, right?
Yeah,
Exist within AMC.
they do, because AMC has about 27 clients, and I think our employee count is between 140, 160, something like that right now. So yeah, we have a number of ERGs. I also like that we lean into using Clifton strengths. So whenever an employee starts, we all get our strength profile. And then we've had consultants come in and work with us on training how to understand our strengths and how to work with each other with different strengths. And we at the Academy also do this for our board. And so the board and the staff get a list of all the employees and the board and the strengths, and we can reference that, which has been really helpful when you encounter sort of a challenging situation and you want to think about how to approach it. Being able to go back and look at the Clifton strengths and kind of think about working it through that angle is really helpful. So I love that. I also think that AMC is doing some things in terms of employee professional development and performance that I like. So we've moved more to a conversational performance kind of process. So we call it ACE, which stands for Achieve, Connect, and Empower. But the idea is, instead of having that one annual review where you tell everybody what they need to do better, you have conversations throughout the year to set expectations and to provide feedback. And it happens more organically throughout the year. And I think that's really positive. And you couple that with an environment that really believes in investing and supporting professional development. And I think it makes it a powerful place to work.
Wendy, I have often found that associations take on the culture of their members. Like when I was talking to Jose Seguera, he said, look, I work with auditors. They're very precise. They go deep. They want to ask lots of questions. You partake of two cultures because you've got the culture of AAHPM and you've got the culture at AMC.
Mm-hmm.
How do you marry or integrate those cultures?
Yeah, I don't think of them as different things. And I think we're working on sort of one AMC. I think one of the things is that AMC itself has 27 clients. 20 of those are healthcare associations. So that's kind of a space we've staked out. 7 are science and trade. And I think there's been this focus on culture, being caring, mutual trust, respect. As I said, I was looking for an organization that mirrored my values. So I think there's an integration, if you will, across. I don't know what the other client CEOs would say, but for me, there's not a negotiation that has to happen with that. It's just a very natural fit. For those who aren't familiar with Association Management Center model, there is an organization called the Association Management Center Institute, AMC Institute. They accredit AMCs, and there's a lot of different AMCs out there, a lot of sizes, a lot of different cultures. So I think if anyone is considering taking a role with an AMC, it's worth doing a little research, on are they accredited? If not, why not? What's the culture there? Talk to someone and find out. Because it may be that there is a dissonance between a client and an AMC. I don't know. But I think you can, as with any job or role, you can do some research and find out.
That is great advice. Now we got to turn to something else because May, in addition to being my anniversary month, is also Asian American, Native Hawaiian, Pacific Islander Heritage Month. Wendy, you and I are on the ASAE AANHPI task force, and we've got a lot of things planned in May. But let me ask you this question. I guess you call yourself Japanese American, Okinawan. How do you feel like you fit into this big community? Because it's a really big tent.
It is a big tent. I think for me, one of the things I try to highlight in this work is the diversity within the AANHPI group. In fact, I think the aggregation sometimes masks some issues. So I'll give you an example. We're often held up as the model minority, which was a concept that was divided to create a wedge among people of color. So kind of a myth.
Total myth.
And we're held up as that because we have the highest average income. But that's not actually true. If you disaggregate the data and look at income across the 50 plus ethnicities that make up the group, we are among some of the lowest as well. And so I think the important thing when you're looking at the AANHPI group is to dig a little deeper in the data if you can and begin to disaggregate it. I think that's important too when we're looking at health inequities as well. For me, I love it when I meet a mixed race Okinawan female. It's always fun. And I appreciate learning and meeting other folks who bring different backgrounds to this space. I think it's one of the things that makes doing the work of the advisory group very powerful. And we're working to ensure we include as many voices as we can and understand we need to diversify our advisory group as well so that we can begin to reach out more broadly among those 50 plus different identities.
Right, right. Well, Wendy, tell us about the advisory group or the task force. Why do we need it? And, maybe talk about some of the activities.
What was interesting was two colleagues of mine and I who also identify as Asian presented at ASAE a session in 21 called Mythbusters, and it was about dispelling some of the myths. And in doing that, we learned that the amount of Asians that we know about in associations is actually lower than the overall population. So it's around 4%. The overall population is around 7%. And so we realized that it was important to find each other. Actually, creating the advisory group was difficult. Michelle Mason and I wanted to do it back when she was at the forum. And I looked at my list of LinkedIn contacts. I think I had 10 association professional colleagues who were Asian of my 1,000 plus.
Wow.
Of those, 3 were CEOs, me being one, and the other 2 were men. So nobody looked like me. So we decided to roll into the BIPOC group at the forum and wait until we could do that at a national level so that when Michelle went to ASAE, and we're so grateful to her and the ASAE for creating a forum for us to create the advisory group, casting a much broader net nationally. When we started in February of 22, I believe we had 17 people who worked on a strategic plan. And our aim is really to increase Asian participation and advancement within associations. I think we're up to now 29 people in our advisory group, which is very exciting. And we're looking at things like networking, representation, a number of other areas to ultimately achieve that goal of seeing more Asians in associations and seeing more at the C-suite level so that folks can see themselves. And representation matters.
I totally agree with you. What do you want the association community to know about us, this community, and the advisory group?
So one of the things I'm excited about is we're trying to encourage folks in our group to use their voices, particularly in May. And I've spoken to the group about how it may feel uncomfortable. We're not necessarily used to bringing attention to ourselves, casting some broad generalizations. And I think that even for me, I am very passionate about trying to ensure that within medical associations, we move away from underrepresented in medicine, because when you use that terminology, Asians are left out of leadership programming. And while there is a very important problem about representation in medical field with some groups of color that needs to be addressed, it's not okay for Asians to be left out of the conversation. Asians experience discrimination, the highest level of microaggressions. There are health disparities. And so it is difficult when I'm the only Asian in a room of other medical colleagues to lift up that message. And yet I think it's important to lift it up, because if I don't lift it up, nobody will lift it up, and Asians will continue to be invisible as this discussion unfolds. So that's why I'm so excited about AANHPI Heritage Month. It's an opportunity for us to lift up each other, lift up some wonderful historical leaders.
Wendy, voice is really important to you. How do you use your voice to affect change, to raise other people up, and to just kind of make people aware of what's happening?
So I think that my perspective on this shifted after George Floyd's murder and the murder of the Asian women in the spa in Atlanta. And I decided that it wasn't okay for me not to add my voice. And it's hard. So I feel a sense of responsibility when I'm in a room and it's not being talked about. I now feel like it is my duty to talk about it. And I do try to acknowledge that it's not the oppression Olympics. I think that work that we do to lift up voices for Asians lifts up voices for other groups as well. And we need to do this work so that no one experiences hate or discrimination or violence. And then I think about the old people that are being attacked, and people don't know that that's still happening. Elderly Asians are being attacked on the streets because people are perpetuating Asian violence at a number that's astronomically higher than it has been recently. And so I think for them, it's important that we talk about it so that people know that it's happening. I remember I bought a car, I think it was about 20 years ago, 25 years ago. And when I was signing the papers, behind the guy was a newspaper page, old time thing, that said, "Kill the Japs." And so when I got done with everything, a day later, they all called me and they said, "Hey, is there anything we could do to make the experience better?" And I said, "Well, take down the "Kill the Japs" sign might be nice."
Yeah.
They said, "Oh, our owner's never going to do that because they're angry about World War II and Pearl Harbor." And I'm like, okay, well, that's what I'm saying. So if you don't let people know, they're going to think it's okay. So I think it's a sense of responsibility that helps me use my voice, but it's hard.
Wendy, why is it hard?
Because I think there are horrendous things that happened to the Blacks that were enslaved in our country, or the Native Americans who we took that. Like, there are so many horrendous things. And I have a certain amount of privilege in being part white, being able to pass, having parents that were able to put me through school, that it feels a little uncomfortable. Now, that doesn't mean I didn't experience discrimination. Some of my friends are shocked to find out that I did, right? But I think it's just hard because I don't want my voice to be heard as meaning our issues are more important than the other tough issues that are out there. But it's not okay not to say anything because of that fear, because if we don't say anything, then people won't know that we still experience discrimination. And, when I talk about the bamboo ceiling, many people are surprised to hear that that occurs. And I think when I pulled data and you look at the leadership progression for Blacks and Hispanics in this country, we've made some progress, not enough. But you can see data that shows we're making progress. If you pull that same data for Asians, no progress in the same period of time.
Wow.
And that is because we are often not included in the leadership development consideration set because we're seen to be the model minority, or we're seen to be overrepresented in medicine, or people think we're white. Like, I don't know.
Overrepresented in math and science. Right.
Yeah. So I think the fact that there are no leaders that look like me is something I would like to change for the younger Asian women, especially coming up through our profession and other professions. And it is, when I point this out, some people say, well, there are some prominent, South Asian doctors on TV. I'm like, But if you look a little further, how many are deans of medical schools? How many lead tech companies, right? I mean, it really isn't what one might think it is, again, because I think there's this invisibility,
right,
that people just don't see it and then believe what they want to believe. I've gotten more comfortable. And I think one of the things I hope to do in using my voice is encourage others to use their voice. So I remember at ANC, one of the things I loved is they create moments for employees to reflect on things that are happening. And so we had one of those after the killings in Atlanta. And I reached out to a few of my colleagues who are Asian to see if they would do it with me. And one of them had not really thought about what it meant to be an Asian in America until that occurred and until he had had a child and had to think about what it would mean for his child, but had not really talked about his experience of being an Asian transnational adoptee. And so I'm proud when I can help others to share their story and use their voice as well.
Well, Wendy, I am really proud to know you. I'm proud to have you as a client. I'm proud to have you as chair of the advisory group. I want to thank you for everything you shared today and everything that you're doing. And for our listeners on this podcast, I will put in the show notes the link to last year's podcast interview that I had with Wendy, because you're going to want to listen to this if you haven't already heard it. Her journey and the things that she shared are absolutely wonderful. And Wendy, I think we should also say that the AANHPI advisory group is planning more activities in the coming year to make us more visible, but also to really reach out and expand the community. So be on the lookout for a LinkedIn page and gatherings at some of the ASAE events coming up. Please find us on LinkedIn this month. I will put a link in the show notes and we will gather. And it's not just going to be for AANHPI, it's going to be for everybody, especially allies and people from other groups.
Yep. And I will say thank you, Joanna, because I love to tell the story about a colleague of mine who chased me down a hall because she saw another part Asian woman and wanted to connect. And we don't want people to have to run down the hall to find people that look like them. So thank you for lifting that up.
Well, listeners, find me, find Wendy. We'll see you at an ASAE event coming up.
Find us.
Thanks for listening to Associations Thrive. We're so glad to have you here. You know, my personal mission and the mission of my company, Matrix Group International, is to help associations and nonprofits increase membership, generate revenue, and thrive in the digital space. I want to hear stories of how your organization is thriving in today's challenging landscape. Please apply to be on my show by going to podcast.matrixgroup.net. By the way, do you need help with a digital initiative? Maybe it's a website redesign, a new membership database, or a hybrid meeting that you're planning. I'd love to connect with you. Please visit the Matrix Group website at matrixgroup.net. Thanks again for listening to this week's episode of Associations Thrive. Don't forget to subscribe to the show, leave a 5-star rating, post a comment, and share it with your colleagues and friends. Bye!